Everyone feels aches and pains from time to time. They can be the result of a long day at work or a poor night's sleep. But for individuals with rheumatoid arthritis, the pain is chronic, making everyday life difficult. While doctors don't know the exact cause of the illness, they do have effective strategies for treating it. The first step is getting a proper diagnosis.
So basically going bend down the tip of your thumb.
Rheumatoid arthritis, or RA, stems from a disorder of the immune system. It can be difficult to diagnose during its early stages because the first indicators are similar to those of other forms of arthritis. Common symptoms include fatigue, loss of appetite, widespread muscle aches, and early morning stiffness in the hands and feet that lasts for more than 1 hour.
The symptoms of rheumatoid arthritis are subtle at first, but become very clear as time goes on. It usually starts out with mild aching, pain, and stiffness that people may think is just part of their normal daily experience. The joints then become swollen and stiff. People have difficulty with their routine activities, and this inflammation causes the joints to swell up, and ultimately they can become deformed.
As rheumatoid arthritis progresses, joint pain sets in. Tendons and ligaments get stretched out of shape by persistent swelling, and bone decay can occur. Without proper treatment, permanent joint deformities can develop. That's one reason why it's so important to get diagnosed early.
Hi, Ms. Garcia.
Morning.
How are you?
Fine.
A diagnosis of rheumatoid arthritis usually begins with a visit to an internist or a rheumatologist.
Doing any exercise at all? So the first and the most important way to find out about what kind of arthritis you have and whether it is rheumatoid arthritis is to sit down and talk to your doctor. And he should listen to what your symptoms are and ask you some questions. For instance, what do you feel like when you get up first thing in the morning? Are you stiff? And how long does the stiffness last? What areas of your body are involved? So let's take a look and see how your joints are doing here.
To rule out other forms of arthritis, your doctor will look for one of the telltale signs of RA, symmetry.
Rheumatoid arthritis is interesting because it usually affects the right and the left-hand sides of the body equally, whereas other forms of arthritis don't.
Does that bother you when I do that?
Your doctor will also perform a physical examination, inspecting your joints for inflammation and checking the skin around the joints for redness, a sign of rheumatoid arthritis. Your doctor will also test your reflexes and muscle strength.
This gives us a sense of how strong you are going to give at a hard pinch.
In addition, X-rays may be ordered to determine whether any joint decay has occurred. When making a diagnosis, a doctor will also look for other signs of the malfunctioning immune system associated with rheumatoid arthritis. Many people with RA experience hot flashes and sweating brought on by increased blood flow. In some patients, inflammation can occur in the eyes, lungs, and on rare occasion, the membrane around the heart. Finally, signs of RA will often be present in the blood. A doctor may order blood tests to check for a specific antibody called the rheumatoid factor. However, not all patients possess this antibody. Other blood tests will look for signs of anemia, which is a lower than normal red blood cell count. A diagnosis of rheumatoid arthritis can be difficult and upsetting, and for many, it can have life-altering consequences. But it's important to remember that a number of treatment options are available to help alleviate the symptoms and manage the disease.